Japan has a well-established collaboration network among its health and medical care systems. This is one of the major factors to keep high standard in health and medical services in Japan. What kind of functions does Japanese health and medical administrative system have? In this program, you'll be introduced to outline of the health and medical administrative system and the main functions of each institution in Japan. First, let us have a look at Japan's administrative system. Japan's administrative system is characterized with a three-layered structure, which consists of the nation, prefectures, and municipalities respectively. Prefectures and municipalities are self-governing bodies and are often referred to as local governments. In Japan, the health and medical care services are separately provided by different organizations. Health services such as health education and babies' health checkups are provided by public and municipal health center under the responsibility of local government. But medical services are not provided in health centers. Instead, hospitals and clinics provide the medical care services, taking care of the sick. Now, let us see the health administration system. The Ministry of Health, Labor and Welfare is responsible for the system in national level. The main function of the Ministry of Health, Labor and Welfare is to make policies and programs for establishment and maintenance of various systems for health, medical care, and welfare services. On the other hand, the main function of the local governments is to bring an effective health services to people in their community. Now, let's see the detail of the role of local governments. In Japan, there are 47 prefectures and approximately 1,800 municipalities. Each prefectural government or municipal government plans and practices its own health and medical care programs based on the national policies and programs designated by the Ministry of Health, Labor and Welfare. These prefectural and municipal governments divide their administrative boundaries into several health districts. A public health center is established in each one of those districts. Moreover, under the supervision and guidance of a public health center, there are municipal health centers which provide direct services to community people. Now, let's see an example of a family to see how people in Japan receive health and medical care services. Here are Mr. and Mrs. Yamashita, who guide you in this story. Husband, Mr. Akio Yamashita, is 35 years old, and his wife Hanako is 30 years old. Akio works for JICA as a program officer, and Hanako works for a private computer company as a system engineer.
山下さん、件どうなった？
健康様に確認します。
They got married 3 years ago and want to have a baby sooner or later. Akio always looks very healthy at office and at home. However, recently he has something to worry about. Every time he gets up in the morning, he feels a pain in stomach. As he had the same feeling last month, he decided to see the same doctor as he usually visits. Then he goes to the clinic. This is a clinic close to Akio's home, specialized in internal medicine and pediatrics. In Japan, people can choose any clinics or hospitals to go as they like. This time, he chose the clinic close to his home. He visited there the other day to have examination, and today he is supposed to consult the doctor for diagnosis. Here is some explanation about Japanese medical institutions. They are divided into 3 major categories. First, hospitals. Second, clinics. Third, midwifery practices. Hospitals and clinics are under registration and supervision of local government. Generally, adults like Akio can choose either a hospital or a clinic to have consultation. He can choose either public or private institutions. Health centers in Japan don't provide medical service, so he doesn't choose one this time. Then Akio chose a private clinic close to his house by himself. However, if one wants to have consultation at some large-scale hospital, like Medical University Hospital, a letter of introduction may be required. Let us go back to how Akio is doing.
この前の胃カメラの検査の結果ですけれども、特別潰瘍とかご心配なものはなさそうなので、慢性胃炎ということでしばらくお薬を飲んでいただくということでよろしいと思いますけれども、はい。それでは、薬を薬局でもらってってください。はい。それじゃあお大事にしてください。ありがとうございました。
Now, Akio finished with his doctor's consultation. He received a prescription the doctor issued and has to pay the consultation fee. He has to pay 30% of all amount of fee because 70% of it is covered by the health insurance. In Japan, everyone is obliged to carry some kind of health insurance. Furthermore, each medical treatment and prescribed drug has its fixed price. So, fee for a certain treatment or a certain medicine is uniform whichever clinic or hospital you go. There's no difference between public and private institutions. Then, he goes to a pharmacy near the clinic. He submits the prescription to the pharmacist and receives the medicine. Here again, 70% of all amount of fee is covered by the health insurance as well. Anyway, Akio's pain has nothing serious, but maybe he would better go to the clinic several more times. Now, let's turn to Akio's wife, Hanako, who works for a private computer company. One day, she felt she might be pregnant, so she bought a pregnancy test kit at pharmacy and tried it at home. It was positive. She told it to her husband. What a wonderful surprise to Akio! The next day, she went to a private obstetrics gynecology clinic to consult a doctor. Of course, she is also able to choose any hospitals, clinics, or midwifery practices. The doctor examined her and confirmed that she is pregnant and already in 8th week. The doctor told Hanako to come to the clinic every month for checkup. In addition, the doctor advised her to report to the city hall and claim her maternal and child health handbook with medical vouchers for health check. Sometimes, such advice is also provided by midwives. This is the city hall in the municipality where Yamashita family lives. The following week, Hanako visits the city hall health department to make pregnancy registration. From now on, she is able to receive the health care services provided by the local government. A public health nurse at the department introduces her and gives her maternity package with explanation. The package includes a MCH handbook, medical vouchers with which she and her baby can receive free medical checkups, and a booklet containing health tips on pregnancy and baby care. This is a public health center, which is responsible for Hanako's community. A public health center has variety of roles and activities, especially planning, supervision, and evaluation of the health programs. They are in the field of infectious disease control, food hygiene, HIV/AIDS, maternal and child health, and so on. All kinds of health professionals are working for these purposes, such as doctors, public health nurses, pharmacists, etc. On the other hand, municipal health centers are established under municipal governments or public health centers. They provide comprehensive health services such as health promotion, health checkups, and immunization directly to community people. Let's take up Hanako's case as an example to see how public and municipal health centers in Japan provide their services. One day, Hanako goes to a hospital for periodical health checkup using the voucher. The doctor happens to find some abnormality with her. The doctor firstly decides whether to treat her or to refer her to an appropriate hospital. Then, the condition will be reported to her local government. The local government will report it further to a public health center in charge. Under the supervision of the public health center, the municipal health center will provide various countermeasures to Hanako, such as arrangement of public health nurse visit. Such services are provided in collaboration with the municipal government and hospitals in her place of residence. This follow-up continues until Hanako holds her baby in her arms. After Hanako gives birth, a baby will take some health checkups and immunizations at a municipal health center. Now, let's sort out the important points to learn today. As seen in this video, health and medical services are administered in the different systems in Japan. Policies for health and medical care are formulated in national level by Ministry of Health, Labor and Welfare and handed down to local governments and medical institutions. Local governments implement health and medical programs designed for respective areas on the base of national policies. Public health centers and municipal health centers play major roles in the health systems under local governments, but they do not provide medical services. The public health centers are in charge of planning, supervision, and evaluation of the health programs for their responsible areas. Under supervision of public health centers, municipal health centers provide health services such as health promotion directly to local residents. Hospitals and clinics are the core actors in providing medical care to the sick and ill. Anyone in Japan can choose any hospital or clinic, no matter public or private. Most part of medical fee is paid by the Health Insurance Association. Japan has achieved universal health insurance coverage for all. Let us go back to Yamashita family. It's already been 5 months since Hanako gave birth. The baby will grow up being much involved in the Japanese health and medical care systems. See you again in the next story. Goodbye. Sayonara.